Hi, this is Mileah Kromer, director of the Goucher Poll, and you're listening to the Conduit Street Podcast, a source of news and notes on Maryland politics and policy viewed favorably by an overwhelming majority of Marylanders.
Hello and welcome to the Conduit Street Podcast. Kevin Kennelly here with Michael Sanderson here on Thursday, May 13th. Michael, we're recording remotely today. How's it going in your neck of the woods?
Things basically good here, and I'm happy that even though this is a remote recording, it's out of convenience rather than caution. So that feels pretty good. I don't really feel like I have any reservations about being in downtown Annapolis on Conduit Street. I just had some things that lend themselves to working from home today and feel kind of cool doing it. Anyway, all good here. How about with you?
Doing very well. And yes, we are excited that Governor this week announced that most of the restrictions will be lifted. All of the restrictions will still have a mask mandate. And we're going to talk about that. And we're going to talk about vaccine hesitancy and why it may be difficult to get to the benchmark set by the governor to relieve us of the mask mandate. And to do that, we have nobody better to understand the public opinion and how it corresponds with these issues than Dr. Mileah Kromer. Dr. Kromer is a friend of the podcast. She has been on before. She is an associate professor and director of the Sarah T. Hughes Field Politics Center at Goucher College. Dr. Kromer, thank you so much for being with us today.
Hi, guys. Thanks for having me.
So I guess we need to open, of course, with the Goucher poll. Dr. Kromer, we haven't talked with you since your last poll. Talk a little bit about the poll and some interesting takeaways that you and your colleagues at Goucher found from the latest public opinion poll for Marylanders.
Sure. So I think the most important takeaway of our last poll, now keep in mind, it feels like it was a lifetime ago. So we released that poll. It was taken in the end of February. So we released it, I think, the first week of March. But it had a really important finding. We were really interested in teasing out who wanted to get the vaccine, who was hesitant to get the vaccine, and how that attitude fell along sort of demographic lines. And so a historic caveat of sort of vaccine hesitancy is that typically communities of color, specifically African Americans, typically have higher vaccine hesitancy rates. Now, we saw that slightly elevated on our October poll, and some polls taken early on in the fall and through the summer, suggested that might be the case again. But what was really interesting, and on our poll in what we released in March, is that the difference between white Marylanders and Black Marylanders was effectively non-existent. So that vaccine hesitancy rate was closed among Black Marylanders, and it just becomes a really, really important finding. Because once you identify that it's not hesitancy, and then you look at the vaccination rates at the time and notice the huge disparity between white and Black Marylanders in terms of the folks who are getting the vaccine, it suggests that, again, not hesitancy, but accessibility. Mm-hmm. And that becomes, I think, really important things that pollsters, not just obviously me here in Maryland, but nationwide, pollsters, particularly the Kaiser Family Foundation, have been looking at this and teasing it down and really trying to identify who among us wants the vaccine and who doesn't. And there are serious public health implications for both of those numbers.
So I find that really interesting. And to me, it's sort of an illustration of the role of public opinion polling as being more important than just, I'm running a campaign for a candidate and I want to know where the candidate stands among the prospective voters. I mean, everybody, I think intuitively, probably every Conduit Street podcast listener intuitively understands that kind of, sometimes we call it horse race polling, mm-hmm. Who's ahead in a race, or is this ballot question likely to pass, or things of that nature, which they have a place in politics and so forth. But this to me, feels different, that this is an opportunity for policymakers to shape policy maybe differently based on what they're hearing about Marylanders' thoughts. And back in February and March, we collectively, the whole Maryland decision-making apparatus, everybody was very focused on what kind of communities do we need to reach with the vaccines as we have limited supply and so forth. And we're getting them to people who are in, retirement facilities, been working on our essential workers and then expanding out from there. The idea of hesitancy and where it exists should be a pretty important part of making those decisions. You're doing more than just informing those of us who watch horse races, right?
Yeah, and so I think polls, especially people like me who do like what we call public polls. So polls primarily used for public consumption. That we show everybody the results versus sort of the private internal polls that only get to be seen by the insiders. So most people, when we put out our results, the things that people really want to focus on are the horse race, and they care about the approval ratings. But it really does demonstrate how important having an accurate gauge of public sentiment and attitudes is for the policymaking process. So, oftentimes you'll see people criticize polls like, you shouldn't be governing by the polls. You shouldn't be relying on the polls to pick your position. And listen, I think there's a lot of valid criticism there, although I have always argued that at least to some extent, government needs to represent the will of the people, and we need to be accurately reflecting that. But in terms of a public health issue like this, the ability to say that no, it's actually not African Americans who are hesitant, or to say, wow, our public health experts to try to relieve vaccine hesitancy among African Americans have really worked. I mean, you have to give the state and a lot of local county health departments a lot of credit. They spent a lot of time, they focused in on, this historic vaccine hesitancy and made sure they had people like Freeman Hrabowski getting vaccinated in front of people. So pillars of the African American community to help encourage people to do this is what health departments, state and local did. And so polls also can show that, right? They can show you closing the gap.
And that's so important, right? Because then you're realizing, like you said earlier, it's not hesitancy. We did the things that we needed to do. Now we need to pivot maybe, and maybe it's about access and equity. Those are the kind of things that they need to understand, because where you put your resources is really important, especially when they're limited. And Dr. Kromer, when it comes to, shaping, understanding the public opinion and, not so much the horse racing, we saw the same thing with police reform, right? And I think we talked to you about that last time. Those public opinion polls certainly played a role in the policy at the state level. So, I mean, would you agree?
Yeah, I mean, listen, I can't get in the head of any single member of the legislature who actually are advocating for this. But I think it is a comfort to those who are advocating for dramatic changes in public policy to see that the public is, by and large, by their side. That they've done the effective groundwork, I think, or at least the sentiment that that things needed to change. That the public may not know the individual, the nuances of legislation, but the public can tell you that clearly there's an appetite for police reform. They're not happy with the way things are going, and they would be open to the X, Y, and Z changes to the way we do, the way that the police interact with communities. And that's important. It's important for lawmakers to have that information. And we're always happy to provide that public service to the state. At least that's how we view our role here in the state.
Right. I guess as you talk about the Goucher poll as an instrument, I think the preeminent instrument of public polling for the state of Maryland, and it can be a guidepost. I think that's an interesting side discussion about don't govern by polls, but at the same time, if polls inform you of what your residents and your constituents think and believe, it would be folly to ignore that. So I think there's an interesting balance there, but I'm also, this is something we got into when you were on our podcast before, your I think, really aggressive interest in trying to phrase and frame questions fairly so that the results they feel more neutral and reliable. And that's not always an easy prospect. The issues are not always so clearly defined that everybody agrees that these 13 words are the right way to say what the legislature is considering, right? There's some art in that.
No, there really is, and it's a lot of these policies are just complex, and so there's oftentimes issues that I want to ask about or nuances that I want to ask about, but it just doesn't translate over the phone in a public opinion poll. So you have to ask about specific topics, but within that framework, they have to be broad enough that the folks can actually express an opinion on. And I think the big thing for people to keep in mind, especially for people who would listen to this podcast or really follow the legislature closely, is that you're on ducks. Like, you're not the average voter. You're paying attention to the specific details, and the average voter just isn't. Now, but the average voter does have a clear view of what they think is right and wrong. So they understand that police reform needs to happen, or they understand that, like, body cameras, they agree with body cameras, or they agree, with whatever broadly with this issue. And then I always say, like, I look at public opinion polls like this, that I'm going to try to give you a neutral snapshot of what people think, but it's up to the advocates what they want to do with it. They shouldn't, it's not like it's set in stone. You can move people, you can move their attitudes and opinions. If you think that the policy is right, and the public is wrong, it's just your responsibility then to move the public.
Right. And you can also try and nail down what part of the policy the public thinks is wrong and try to sway them in that way. But Dr. Kromer, back to your latest poll, anything else interesting? I know it seems like, forever, eons ago, but that's how this pandemic has been from the start, right? So anything else that you found particularly interesting outside of, closing that vaccine hesitancy gap?
So we're actually, as we're talking, we're at a really interesting point. So I think we're at 65% of Maryland adults have now been vaccinated. I think that's what the number was today or yesterday. Right. And Governor Hogan, recently announced that once we get to 70% who have at least one dose of Maryland adults, then he's going to lift the mask ban. And what's interesting is that 64% on our February poll, that was the percentage of Maryland adults who had either already gotten a shot or were planning on getting a shot as soon as possible. So those are the folks who initially back in February, who either already got it or they wanted to get it. So that's where we're at right now. I think a lot of the people who who wanted to get it have got it. And now it's about appealing to that next percentage, like the folks who said, oh, I'm going to wait and see. The 18% who said, I'm going to wait and see. So now it's about, like, chipping away at those people. So how many of the wait and sees people have seen enough and they're ready to get vaccinated?
Right. And I guess what's probably inherent in that split is among the people who responded to the Goucher poll and said, I'm not planning to do this soon, you probably have some people who are in that wait and see category, or I want to see people around me getting it, and I'll be watching for news reports of difficulties or that sort of thing. You also, I'm sure, have some people who are fairly deeply embedded and probably unreachable, right? We know that there are some people who, for whatever reason, they're against this vaccine, and they have a paragraph to tell you why, and it's probably not going to be possible to reach some of our neighbors and friends. We have to assume there's some of that, right?
Yeah, then that's what certainly polls indicate. And I'm not a public health expert, and I'm not, but from everything that polls have shown, there is certainly an immovable percentage of the population. They're just not going to get it. They're afraid of it, or they think that and if you thought COVID was a hoax, you were not likely to take a free vaccine from the government.
Right.
So, I mean, all these sort of attitudes are tied together.
It's interesting because, vaccine hesitancy existed prior to COVID. And I assume the public health experts were looking at previous polls to sort of figure out what percentage of our population is already hesitant to any vaccine. And we already know that exists. And then we're going to have to deal with the stuff with COVID as well. And so, sort of the rumors and whatnot. And then the Johnson & Johnson vaccine, they recalled it for a bit. And that certainly was a challenge, I think, PR wise, to explain to people that, hey, we're just slowing it down to make sure there's not a problem. It's very, very safe. So all of that plays into this. But of course, there are those people there that they weren't going to get it no matter what, because they weren't going to get any vaccine. And I think polling plays a big role in identifying that group prior to even starting an outreach campaign, understanding where you are before COVID and before trying to make sure people get the COVID vaccine.
Right. And so what we know now is, like, the people who are refusing to take it are more likely to be Republican. They're more likely to be white. And there's actually a pretty significant part of the population that are younger Republicans. And so to me, I think that's a group that perhaps we could do a better job targeting. to try to change their minds. But at this point, some focus groups have found that like the trusted figures in the community, particularly the faith community, are good at convincing people to get the vaccine. The problem is capacity. We're still talking about, hundreds of thousands, millions of people. Individual local doctors, the trusted community members, don't have the time to talk to every single hesitant person.
Right.
It just becomes a numbers game. And you hope that we can get at least it up to 70 or 80%, at least high enough, that maybe we get to a ballpark of herd immunity. But from a lot of other reports from public health experts suggest that we just might not ever get there. And so that you and I will be taking booster shots in the future.
Right. And that 70% benchmark, that's also one that President Biden set before Independence Day. That's the goal, is to get 70% of Americans vaccinated. But Dr. Kromer, so we know that there is still vaccine hesitancy out there. We know that it's a problem. We know that it won't be easy for Maryland to get to that 70%. I do think it's interesting that your polling showed about exactly where we are right now. That was the group that said, as soon as it's available, I'm going to get it. So, other states are dealing with the same issue, right, Dr. Kromer? I'm sure you have colleagues elsewhere. Are you hearing anything from other states or from your colleagues in terms of where Maryland is versus other states or regions in the country?
Well, just to clarify, it's like I actually do think that we're going to be able to get to that 70% of like first dose adults. But keep in mind that we're changing the denominator a little bit. Now we're opening the vaccine up to 12 to 17-year-olds. And we also, the secondary measure is not just one shot, but for everything, for the Moderna and Pfizer, it's getting the 2 shots. So there's some gray area in there with the statistics. But again, to be at least getting to 70% among all adults, the first vaccine is a good goal. And let's hope that we can get, obviously get more people to take it. But to your point, what you see now is states doing a bunch of different things and the private industry to just encourage to get there. Like if you're the folks who are like sitting on the fence, the wait and seers, like they're waiting and seeing, they're maybe not so much like flat out saying, I'm not going to take it. So it's like nudging those people. And I think the governor of, you have to respect like the go big or go home is using some of the federal funds to do $1 million lottery if you get entered into if you get vaccinated. So that is a big prize for vaccination.
Right. I think we're starting to see a variety of sort of incentive style approaches. I mean, a few odds and ends here and there, some of them coming from the government and some of them coming from, I guess, civic-minded private businesses. But maybe that's going to be part of this next frontier is some of it's information and some is guidance from respected figures. I'm seeing advertisements while I watch Jeopardy on TV out of Baltimore, and they've got medical leaders from across Maryland who are part of the messaging. And that seems like it's full of very deliberate coding and assurances. And these are the kind of people, they're all wearing white lab coats. You trust people like that and that sort of thing. So, I mean, I always find that interesting, but so that's got to be the next phase of this is some of this coming from the government and some coming from elsewhere, but some of it will be like worms on the hook, right? Don't we think that's going to be part of what's next?
Well, I also think like benchmarking is, which is what Hogan has done, is what's next. It's like now trying to present people with clear benchmarks. Like if we get to 70%, then you don't have to wear the mask anymore. And he's not alone in doing this. Governor Gretchen Whitmer from Michigan did do something very similar. She has a bunch of different, like once we get to 60%, then we can do this. Once we get to 75, and I think that allows people to feel that they're contributing and that there's actually a goal in reach instead of a more of an ambiguous goal. So a clear goal and some ambiguity is probably good for motivation. But there's also like the people, I think the governor gave $100 bonuses to state employees. You can correct me if I'm wrong here. That was one of the things that rolled out, a $100 bonus.
Right.
Which is Not nothing.
It's $100. I mean, yeah, at some point, I guess you get to the point where it's like, okay, money talks. And you mentioned Maryland and West Virginia is giving away savings bonds. New Jersey,
right.
You get a shot in a beer. If you're 21, you get a free beer if you get vaccinated. Free lottery tickets in Kentucky.
Love that handle. That's great.
Right. It's great. Right. So, Maine. Yeah, Krispy Kreme. Maine, you can get a free hunting, fishing license, LL Bean gift cards. I mean, really, everybody's pulling out the stops because money does talk. And, you can have all the commercials and have all the public information, but sometimes you got to pay people to get things done. And I think it's worth the money if we can get there, of course. But yeah, Michael, to your point, you see the advertisements, there's people in lab coats. And if you don't trust them, we have your favorite sports stars. We have your favorite public health officials, just about anybody under the sun. It seems like we're trying to get those community members that are trusted and the community members who are embedded into the communities on TV, on radio, explaining to people the importance of doing this. And for those people that still are sitting on the fence, they just aren't motivated, we'll pay you to do it. Or you can get into $1 million lottery if you get your vaccine. I mean, these are innovative ideas. And I think it's fascinating to see, this kind of effort happening because we haven't really seen this before. At least I haven't, in terms of this kind of an outreach and trying to get people to get the vaccine so we can move forward together.
I think Dr. Kromer hit exactly the right point, that a lot of people are persuaded by an end goal. And if that end goal is something we appreciate, I went to a public health seminar not too long ago talking about messaging these issues, and phrases like back to normal are among the things that are not thrilling or sexy, but those are things people really respond to. And I think a decision like Governor Hogan saying, when we get to 70%, we're going to change some of the rules and you all are going to appreciate that. It'll be less masking and more capacity in places we want to go, but we have to get there together. Connecting, do this so we can all enjoy that, is probably playing the psychology game really wisely. So hats off to the governor and to other figures who are thinking and messaging that way.
The masks make people really upset. And so that was, I think, for a lot of people, they can't wait to not wear them. And that's, again, that might be motivating. I think it's important. One of the things that polls can show you is that I think there's going to be people who are unmovable. It doesn't matter how many cash prizes you give. It doesn't matter how many fun gimmick you put on this. They're not going to get it. But there is a very movable wait and see part of the population. And the goal should be to get as many of those people who said wait and see into the vaccination club. That's the goal. And the good thing about public opinion polls, they can tell you a lot about those people. And then hopefully we can craft public policy and public health outreach around that. So we can all enjoy not having to wear masks anymore.
So Dr. Kromer, we've talked some about the financial incentives, and actually the UCLA COVID-19 Health and Politics Project found that people said they would be more willing to get vaccinated if they were offered cash payments from $25 up to $100. But I guess the question is, if you asked me over the phone whether I'd be more likely to get vaccinated if I got money, I'd say yes. But the ultimate question is, do we know if that is actually translating to actions? Do we have any data that says, yes, those people that said so, we gave them the money and they're actually going through with it? What do you think about that?
I'm not sure. But we will be able to test, certainly. The good thing is we'll actually have data for places like Ohio and all these other places that have now sort of these really big public campaigns where you get a prize. They'll be able to track before and after to see if it actually made a difference. I mean, that would be like the best thing to do with like a pre-test, post-test poll. If you knew where the wait and see was before, you introduced all these different mechanisms to get a prize, and then you could look at the hesitancy rate after each in public opinion. That could certainly paint that picture for you. I'd be interested to see if Maryland does anything else. One of the cool things that Ohio did as well is they offered free tuition and room and board for the Ohio State University for if you were 12 to 17-year-olds, that bucket of people, they could win 4 years paid at Ohio State. I was like, wouldn't that be a great thing to do here in Maryland?
Yes. And Michael, you're an Ohioan. I hope that your family members there are entered into this lottery and maybe they'll win $1 million. Or if they're, if they're younger, they can get a free ride to the Ohio State University.
Right. I've got two adolescent daughters who are soon to be getting their vaccine, and I don't know. Maybe we do this on a trip to Grandma's house in Ohio. I'm not sure. I'm not sure if this will affect our behavior. They're getting their shot either way, but could we be swayed by an incentive? Maybe. So actually, I want to piggyback on Kevin's question because I sort of like this bigger philosophical question. And since we've got you, Dr. Kromer, as the hands-on practitioner in public polling, I'm really interested in that question. Like it seems easy. UCLA asked the question, hey, if you got a bag of money, would you do this thing? And a bunch of people say, yes, I'd be more likely if I were handed a bag of money. Okay, so at what point, I wonder, is there a way to construct useful public polling questions to avoid the almost too obvious answer? Like, to me, I almost want to put an asterisk by that UCLA response. I would say, yes, $100 would make me more likely to do almost anything, although I'm not sure that it really would change my behavior, but I'd probably on a phone call tell a pollster so. Is that the kind of thing that you worry about in constructing questions to keep them moored to reality so that they're relevant?
I mean, listen, you would want to make sure that you were clear with the amount of money. You wouldn't want to say and I know you're just being funny, but you wouldn't want to say a bag of money, right? You want to be clear that you mean like a realistic of $25. And then you could ask again about $100. Mm-hmm. But the interesting thing would be is maybe you get a little bit of, oh yeah, maybe it could sway somebody's response that's not a true behavior. But what would be really interesting is to look at the folks who are like, it doesn't matter if you gave me $1,000, I still wouldn't take it. Right. So understanding that would help to me illuminate the folks who are really dug their heels in and would not take the vaccine at all. So then you could up how about $1,000? Would you do it for $1,000? And then the individuals who would flat out refuse, and even at that ridiculously high price point, those are the folks you're not going to be able to move. And right. So I think that looking at it that way, it actually helps shed some really important light on what the information the poll can glean.
Yeah. Now I'm intrigued. I want to break this question down even further. I want to do A/B testing and say, sure, if the money came courtesy of Dunkin' Donuts as opposed to courtesy of the federal government, would you respond to one of those differently? Maybe suspicion of government is one of the elements of vaccine hesitation. And if this were just you get a free beer from some company you've heard of, or you get a free cup of coffee or a bag of donuts or whatever, maybe that goes down more easy than you'll get a government issued check or something. I don't know. I don't know. All this is
gratification. Yeah. I would, if it was me, I would, and maybe it's just because this is how I am, I would err on the side of as much instant gratification if I could give people. You walk out, you get a $20 bill, yep. or you get, or you can walk right over to your local bar and get a shot and a beer. So, and I really do think, it's that you bring up a really important point in terms of people's hesitancy with the government. This is where the private sector could really step, people like Krispy Kreme have already done this, could really step in and, it's good for their marketing, and then it's also good for public health.
Absolutely, it is. It is fascinating, and people like free stuff. We know that. So we'll see. Hopefully, that the numbers continue to tick up. And Dr. Kromer, why we have you again, and to pivot a little bit away from COVID, and maybe along the lines of what Michael was asking in terms of polling and actual results, we see a lot of general government ballot questions, and oftentimes people vote yes. And there's a lot of talk about, how the questions are written and do people understand. But I'm interested in knowing, just because we've gone through an election cycle and counties had a lot of general government questions, the state did as well. Have you seen any bias toward people just voting yes for those questions? And maybe they don't want to read the whole thing, but is there an inherent bias just to say yes to something, even if maybe you don't understand it, if it's just on a ballot in front of you, you're there because you want to vote for A, B, C, D, but then, there are these questions here too. Have you found that people are more likely just to say yes or vote yes in a poll or in actually the voting booth?
That's the biggest problem with some of the ballot initiatives, not just here, but obviously across the country. It's that they're lengthy, and most voters don't show up with, having read them beforehand. And there's a kind of a push to get your vote in and then get out of the voting booth. And so, right, I think that there certainly is a bias to go ahead and vote for those things. That's why you have to have these really strong public advocacy campaigns to explain and boil down that language to, really clear, like, what does a vote for or a vote against mean? That to me is like, I love the idea of that direct democracy, that people come in and they vote directly for a law or a bill that's going to affect them, or a bond. But the problem is that people, by and large, sometimes they're not spending the time to sort of read it, and on the back end, they're written in a way that I think that a lot of people, it's confusing for people. And I'm not going to say that's done on purpose, but it's confusing. It's really tough for voters under those circumstances to read something and really fully consider it.
It's probably also an area where the decline in prominence of truly local media is having an effect. I feel like growing up, you could count on the nearest daily newspaper to give you a voter's guide, and here are the 5 things in your area that are going to be up for a question. We recommend 1 through 4 all pass, but number 5, here's why you should vote against it. And that would end up being a big deal. But there was an editorial committee who sat down and made those evaluations and did some of the research that we know we rank and file voters don't always do. That's probably an increasingly lost element, as true local media just has a smaller presence than it once did. This is a bigger question than polling, but it seems on the point.
Well, certainly. And so you have media organizations like The Sun do the big state initiatives. But you're right. There's not everybody weighs in on what's going on in Howard County, and why, and you're right. And that leaves us big dirt. We don't have the information to make these informed decisions. That's why I like the idea of representative democracy in theory, but sometimes the idea of the direct democracy in theory, but in practice, I think these ballot initiatives can be problematic. For some things, not everything, but for some things, sometimes the issue is really complex, and I'm not sure people are really taking the time to really consider their options.
Yeah. So, Dr. Kromer, I think we lured you a little bit into talking about vaccine issues, which is sort of the topic of the day and the issue of the moment. But had we had you on while you were doing your big media parade back in March, I guess, I'm sure you had a bunch of sort of above the fold takeaways from the last Goucher poll, and our listeners are probably interested in a variety of things. Many of them, I'm sure, have seen the last polling data, but anything you'd like to share just broadly about, like, a governor's approval rating is always fun, any of these horse racy kind of things, anything interesting in the opinion on, like, legalization of cannabis, something that we've been launching for a while, any of that stuff interesting?
Well, listen, I pointed this out, back in March. We are at 2/3 now of Marylanders support the legalization of recreational cannabis. It's a high watermark. It's the highest we've ever measured it. It's reflective of what we see nationwide. And some of the states who have actually passed it into law, their approval rating, their support was a little bit lower than ours. So Maryland has like this weird situation where we have really, really high support in the state, but we're sort of not quite there yet in terms of the legislation. And obviously we see Virginia and New Jersey, right, moving right along, trying to get their plans into place. Obviously you'll have to talk to lawmakers about this, but I expect that next legislative session, this will be a really big issue.
Yeah, no doubt about it. And
I think so.
The question becomes, do you just pass a bill or do you put it on the ballot? And, that's the decision that they're going to have to make in the legislature. It's a complicated issue for sure. There are a lot of moving parts, but yeah, Maryland behind a little bit, Virginia, New Jersey, several other states. Same thing with sports wagering, right? We have a bill that was just passed, but we were a little bit behind to implement that as well. So sort of behind the eight ball there, but the public polling certainly makes clear that Marylanders support legalization of recreational cannabis for adults. And Michael, to your point earlier, if we would have had Dr. Kromer on in March, we never would have been able to book Dr. Kromer in March. I mean, every time I turn on the TV, there she is. I mean, she's on every radio station, every TV station. She's a big get. So I would have loved to, but we're happy to have you in May, Dr. Kromer, and we really appreciate your time today. This is a super, super important issue when it comes to understanding hesitation and understanding where those pockets of people maybe are so that you can reallocate resources to make sure they get vaccinated, understand the importance of getting vaccinated, and then also maybe you have to offer some incentives to them. And all of that can be found through public opinion polling. And it's great to get your perspective on that. We really appreciate it.
Can I just say one more thing really quickly? Because you brought up the ballot initiatives.
Of course.
Something like recreational marijuana is a little bit of a different bird in terms of the ballot initiative issue. It's people have an opinion on the legalization of recreational cannabis. So when that appears on the ballot, on a ballot issue, people understand or have a better idea of what they're voting for or against. And it'll also have a large public advocacy campaign around it. So you're going to have folks on both sides trying to educate the public. My hesitancy with ballot initiatives and ballot referendum are the ones that people haven't heard anything about until they've stepped into the voter booth. So it's not so much these really big ticket ones like this.
For sure. And cannabis, I mean, that may be the reason for many people that they're actually showing up to vote. I mean, that may be the only reason. And you're right. There'll be an advocacy campaigns on both sides of the issue. I think we saw this with slots, right? Where, you saw just endless commercials for and against. So people will certainly be aware of what's going on. That won't be one of the ones that doesn't get coverage. But yeah, I agree with you. Some of the local stuff maybe is a little bit wordy and it can get a little wonky, and those are difficult. But an issue like this, I mean, if you pass it on the ballot, you get a little bit of cover because at least the voters approved it and you didn't just do it in the legislature. We have seen states do it through a bill, but most of the time these are ballot initiatives. So I'm interested to see. And it should be fascinating as we lead up to the next election cycle. And I'm sure the Goucher Poll is going to be gauging our opinions moving forward. Dr. Kromer, when is your next poll due?
We will be out in September. So we'll be in the field in like mid to early September, and we'll release some that the third or fourth week in September, we'll probably release another poll. I'm going to try to not do a horse race because I should know better. It's way too early for a horse race, even for the gubernatorial primaries. But it's one of those things that like I say I shouldn't do, but it becomes so tempting. See, I know, because people like you, everybody encourages me, and I can't help myself. It's really, I mean, I keep on I tell myself again and again and again, I'm not going to do it. It's too early. And then I sit there and I just can't not do it. It's terrible. No self-control.
Well, I mean, yes, I would love to see that data. So I am officially on the record encouraging all of those horse race questions, but also the more important questions as we get through the summer. Maybe people's opinions change a bit on the public health spectrum and where we are. So it'll be fascinating to see that. Of course, we'll link all of that information on the show notes and on our blog. Michael, any closing thoughts before we let Dr. Kromer get out of here?
Well, we're grateful to have your time. And I'll say it was 2 or 3 weeks ago, we floated to our listeners, okay, we're getting out of the legislative session and we get a little more free form with our podcast. What do you want to hear? Do you want to hear more guests, or do you want us to, do policy topics and so forth? And if I'm sifting through our feedback correctly, our listeners want good guests, including you by name. And that's great to have you back. And they also want us to stay nerd friendly. So apparently that's kind of our brand. So like a little bit of these probing questions about the nature of polling and so forth, we're trying to understand the lane we're in. But thanks for playing ball with some of our, dig a little deeper stuff. Really appreciate having you as a guest today.
I appreciate it. I feel like I'm very on brand for the winning a little bit nerdy podcast thing. So that's great.
Yes. Thank you so much, Dr. Kromer. And as always, if you enjoy the podcast, please go ahead and subscribe. You can also follow along on social media, Facebook, Twitter, and then of course, the Conduit Street blog. But for Dr. Kromer and Michael Sanderson, this is Kevin Canale signing off, and we will talk to you soon.